There is change people in so many ways. Important thinking in that session about supporting a cyber generation to get the best out of it while keeping well.
True, like in India, every young person needs to be safe in that online world. And it's so great that our 2.0 guidance has been launched today at this global forum, especially with youth and going into that guidance.
No, 100%. So let me tell you what we to look forward to in the next hour. We are some more amazing newsreel from our 1.8 reporters.
And our core sessions are actually about health, about youth leaders breaking the silence. And I think that's so important.
100%.
I mean, did you know that poor mental health outcomes now affect 1 in 7 young people globally?
Wow.
That's shocking. This session is going to look at how youth are shaping effective services, brighter future. Or you can join a session communicating the non-communicable, how marketing policy young people from disease. So, NCDs are the leading cause of death and worldwide, and that is a big concern within my region of the Americas. So this really is a chance for us to add our voice. This call for government commitments, marketing practices which make things worse.
Oh, life-saving and really stuff. But first, let's hear an incredible health who has a powerful story to tell.
Hi, people. It's Meg Zinat Wimithi, and I'm a global mental health leader and educator from London, but also the proud founder of My Mapper, which is a global education to live mentally healthy. I are on at the moment. I that 1 million young people across the world have access to basic mental health education. So thank you so much for being along on this journey. Why is today so important, and why am I so excited to be speaking to you all at this year's Global Forum for Adolescence? Well, because there's 1.8 billion of us. There is, in fact, 1.8 billion young people across the world. And within that, 1.2 of us have been bold enough to say that mental health and well-being needs to be at the top of the agenda. And from me to you, I couldn't agree more. We all have mental health, and we all need to start doing something about it. And within there, it's about time is of the essence, not tomorrow, not yesterday, but today. As it currently stands, mental health is the second biggest killer for young people aged 15 to 25. That is, in fact, out of all of you, out of all of the classes that you 1.6 of us will be suffering in silence with a mental illness, and this is why we need to do something about it. But before I end up talking a little bit about my story, because that's where it started for me, I actually just wanted to say a massive thank you, and actually that I'm so proud of you all. I'm so proud and every single one of us, whether you are there in person, you are streaming online, or will tune into this afterwards. It's not easy to be bold, courageous, or radical enough to stand up for the things that we believe in. And I truly believe that our generation is going to be the one that changes the world. It's not just about talking about the changes that we want to see, it's about being the change that we want to see. So thank you for showing up today. And I just can't thank you enough for all the work that you have done to this point, but that will do moving forwards. So why Meg? Why am I here today? Why does mental health and well-being mean so much to me? Well, when you look at me, do I look like someone that has a mental illness? Probably not. When you look at me, do I look like someone that survived suicide? Probably not. And that's the thing. Mental health has no face. It's a silent killer. Unless we speak about it, no one really knows the silent battles that other people are facing. And for me, mine started when I was only 13 years old, and my story is not unique. When I was 13, I was diagnosed with severe depression, anxiety, anorexia, and paranoia. Sadly, by the time I was 14, I had my first suicide attempt. And by the time I was 16, I had my second. I had my last suicide attempt when I was 20, actually on my 20th birthday, where I was rushed to hospital when I was sectioned. And it wasn't until that 20th birthday and me being at the point of crisis that I finally received the support that I needed. And the thing is, I feel like I'm one of the lucky ones. And I think it is my duty to do more to shout about this, because there's not a lot of people that are proactive enough and feel confident enough or safe enough to talk about it. Right now, at the age of 25, I'm a proud navigator, I would say, of borderline personality disorder, social anxiety, and also as a recovering anorexic. And whilst it may feel scary to talk about my mental illnesses are my superpower, and I wouldn't change them for anything, because at the core of it, the only person that can stigmatize me is me. And therefore, I'm not going to do it anymore. I'm proud. I'm proud of my mental illnesses. I'm proud of everything that I've gone through, because I think I wouldn't be Meg today. My story with Mind Mapper started with me just sharing my story. And it can for you too. It's as simple as that. It's being bold enough to be vulnerable and realizing that that's a strength. But I do have some takeaways for us all today. So once you finish this forum, what can you do? What can you take away? Here are my top tips. Number one, don't just be comfortable having a seat at the table, build your own. One of my core mentors said, if you're not at the table, you're on the menu. And I feel like for so many of our young people, our voices go unheard, or we're just a tick box exercise. We're always on the menu. And I think the big thing that I really decided with Mind Mapper, I didn't just want to have conversations about change. I wanted to be the change. So instead of being comfortable just having a seat at the table, I built my own, and I invited other young people along on that journey. So think about it for yourself. Who can you collaborate with? Who can you bring involved in the work that you're doing? Number two, and I think number two is a really, really, really big one, which is use your personal story to fuel you. Your story is so powerful, and so many people want to hear from it. So please find safe spaces to talk about it. And actually, a reminder for me to you is always, for all those people, because it has been difficult, definitely been difficult, for all those people that made you feel uncomfortable about opening up, there are 100 people that will make you feel so proud that you spoke up. So it's about finding your tribe. Connect with everyone who's joined the forum, share, meet new people. But when you find your tribe, you'll feel so much more confident with your story. Number three, it's absolutely okay not to be okay. You know, there are seasons that we come in life, and I might seem really confident now, but I do have those times as well that I still struggle, that I feel like I'm going back to old habits, that I need help, and that I actually reach out. So if this is you and you're not going through a great time at the moment, just remember that this too shall pass. And actually, that it's absolutely okay to not be okay right now, and to take your time. You know, getting better, needing support, needing help takes time. Number four. Is it number four? Number three? Number four. I think it's number four. But I think the big thing for me is, don't focus on changing the world. Focus on changing your world. It will feel like there's a mountain of problems that you need to solve. I remember when I first started Mind Mapper, I was just like, I just want to change everything. And actually, it's counterproductive that way. I started thinking about how I can change my world, the things that I can see around me, schools, my universities, my workplaces, my friendships, my relationships, my peers, on social media. Doing the small things daily leads to big change. Think about doing the small things consistently, and I promise you the rest will just be like a snowball effect. And finally, find what motivates you. For me, it's that 13-year-old girl, 13-year-old Meg, who never ever thought that she'd make it to her 18th birthday, who's now had the privilege to talk to all of you. Remember that we don't do things alone, and that it's about
Hello, everyone. Welcome and thank you for joining this product's launch session. The title of today's session is Unpacking Marketing Policy to Protect Children and Young People from Non-Communicable Diseases. This session is hosted by NCD Alliance, Children in All Policies 2030, NCD Child, and the WHO Global Coordination Mechanism on NCDs. Next slide, please. I'm Toyib Olatunji Abdulkarim, a Senior Policy and Advocacy Officer with NCD Alliance. I'll be the moderator for today's session. Over the next 48 minutes, I'll provide some background for today's conversation before we have the panel discussion. There will be Q&A right after. Please share your questions with us, and we'll also have some polls at the beginning and at the end of today's conversation. Next slide, please. We will now be sharing the pre-session poll to get your perspective about the topic. Please respond as soon as possible. Can you please put on the poll? The question will be only up for a few moments. For this, we would like to know about your awareness of the topic of harmful commercial marketing, and if you feel you have been targeted before. Thank you for answering the poll. Can you please close the poll and go to the next slide, please? NCDs are the leading cause of death and disability globally. The burden, which is also in young people, is driven by commercial actors who spend billions of dollars annually to target children and young people, harming their physical and mental health. From unhealthy diets, alcohol, tobacco, to gambling, the unhealthy industry uses marketing tactics to influence purchasing habits and decision-making. The policy report we are launching today makes a case for urgent action and calls for national governments to prioritize health, protect our future using legislation and policies. Another recommendation in the publication is the meaningful engagement of children and young people as partners and collaborators. As we proceed with this session, we'll be hearing more about these recommendations and our roles as partners to make communities safer and healthier for children and young people. Next slide, please.
Oui, allô?
Now we'll be starting the panel discussion. Next slide, please. Today, we are joined by Alice and Maria from Children in All Policies 2030. Anna from NCD Child, Danielle from Healthy Caribbean Coalition, and Gabriel from the Bigger Picture.
En fait, ça revient tout le temps pour les livraisons. J'ai déjà eu des livraisons ce matin. Je suis désolée, je dois raccrocher, je suis en réunion. Merci beaucoup.
Next slide, please. Starting with Alice and Maria, can I please invite you to start by sharing your perspective as a young person and present the policy report?
Thank you, Toyib. Before we share the policy report, we want to open this conversation by centering children and young people's voices. So I'm really pleased to invite Alice Mazon to start our presentation with quotes from children about harmful marketing.
Thank you so much, Maria. So, like she said, especially when it comes to harmful marketing practices, we think it's so crucial to include children in the conversation because they have the unique experience of it and can look at it kind of comprehensively instead of just the more explicitly presenting issues. So on this really powerful slide, there are a handful of examples of this. Our responses to this question range from explaining that marketing is way more pervasive than adults think because they don't face the same level of exposure to it, to discussions of how we're made to feel awful about what we're eating in the blame culture that is created and the impacts of this on our body image and self-esteem. Thanks, Maria.
Thanks, Alice. Next slide, please. So as Toyib has already introduced, NCD Alliance and CAP 2030 are really thrilled to be launching our policy report today at the Global Forum for Adolescence. It's entitled Selling a Sick Future, How to Counter Harmful Marketing Towards Children and Young People Across Risk Factors for Non-Communicable Diseases. And you can read the full report by scanning the QR code there on the slide. And next slide, please. So we are short on time today, so I'm not able to go through everything in detail, but I will briefly discuss our methodology for developing this policy report. We conducted a review of scientific and technical literature. We established an expert advisory group to guide our research and our recommendations, and we conducted focus group discussions with over a dozen children and young people from all over the world. We synthesized this information and analyzed existing regulations. In total, we reviewed over 50 countries' regulatory responses to harmful marketing, and then we formed 10 policy recommendations applicable cross-country, cross-sector. Next slide, please. So just to give an idea of the magnitude of this problem, commercial marketing is a multi-billion-dollar industry. It's projected that just this year alone, global spending on advertising will reach $674 billion US dollars. And it's estimated that advertising spend targeting children and young people specifically is around 17 billion annually US dollars. So this is a huge problem. And there are examples on the right of how companies market their unhealthy products to children and young people. You can see they use very enticing tactics such as flavors, colors, toys, celebrities, and they're all advertising very harmful products to children and young people. Next slide, please. So to break this down, we have a graphic explaining how various marketing techniques target child-specific environments and non-child-specific environments through different mediums. So this could be through broadcast media, printed advertisements, online commercials, influencers on social media. And these techniques adapt to technology. You'll see there are traditional techniques listed, such as people and place-based advertising. This is marketing based on information about a known environment or audience, but there are more sophisticated techniques that are becoming commonplace, like contextual advertising. This form of advertising uses online behavioral monitoring to understand the user's likes, dislikes, and even their spending habits to deliver them very tailored advertising content. And we already have things like AI-generated marketing and marketing in virtual reality environments. So marketing techniques are constantly evolving to keep pace with technology, and they're evolving in order to strategically evade regulation. And that brings me to my next slide, please. So this are some of the challenges we face to regulating harmful marketing. There's a lack of available and relevant data to describe the problem and convince decision makers that there needs to be support and buy-in. There's the complexity and global nature of the digital media makes it very hard to monitor online advertising and enforce any sort of regulations. There's no effective method right now for verifying age of users or buyers online. There's insufficient resourcing of monitoring and enforcement of compliance, and inevitably there is poor design and implementation of policy, and sometimes this has unintended consequences. And as I mentioned earlier, there's also powerful industry groups that counter any attempts at regulating harmful marketing, and they all typically use a common playbook. And that's one, they undermine attempts at regulation through lobbying, use of front groups, and flooding of consultations. Two, they promote Hello? Sorry, the Zoom just kicked me out, but I'll just keep going. Hopefully you didn't miss anything. Three, so talking about the playbook that powerful industry groups use to counter regulation. Number three, they instill doubt about the severity of the problem, including through biased research and promoting arguments in favor of individual choice. And four, they shift practices and constantly adapt to evade regulation. Next slide, please. So after reviewing existing regulation and the shortcomings of these regulations in about 50 countries, we identified 7 policy design elements that are key to effective marketing regulation. The 7 are regulating by product, content, age, environment, power, exposure, and technique. And we have examples listed here for each, but we have many more examples in the full policy report. So I encourage you to take a look at that after. And ideally, we would undertake a comprehensive approach to regulating harmful marketing to children and young people. And we would do that by employing all of these elements in our regulation in order to fully protect their rights and their health. Next slide, please. And finally, I want to end by sharing the 10 recommendations we developed for national policymakers to counter harmful marketing to children and young people. We developed these in collaboration with our advisory group, as well as children and young people and people who self-identify as living with NCDs. So number 1, promote mandatory marketing regulation. Number 2, support comprehensive approaches to marketing regulation. 3, ensure environments in and around schools, as well as at off-campus events, are given special protection in marketing regulations. 4, craft regulations to address the power, convincing nature of marketing. 5, use specific definitions, technology-neutral language, and opt-in protocols for data collection. 6, plan for regular policy reviews and embedded evaluations. 7, allocate sufficient funds to implement robust monitoring, evaluation, and enforcement of policies and regulations. 8, mobilize the strong existing scientific evidence on marketing harms. 9, include children and young people in policymaking processes through meaningful and inclusive engagement. And 10, keep unhealthy commodity industries out of policy consultations, prohibiting them from using lobbies or front groups to influence public policy. And I want to come back to recommendation 9, include children and young people in policymaking. In our vast review, there are few examples of young people being involved in marketing policymaking. But in a powerful and rare example, we learned about a youth-led campaign called Bite Back in the UK. Bite Back's policy advocacy against junk food marketing has been incredibly successful. You can read about it in the policy report and you can check them out on their website. But we are lucky to have Alice here, who is a member of Bite Back and is engaged in their policy work. So I'm going to give the floor back to Alice to share a bit about her experience as a change maker in the space of marketing regulation and youth participation.
Thanks, Maria. So yeah, I've been very, very lucky to work with an organization that does put youth at the forefront of what they're doing. And I think from this, I've kind of drawn 2 really effective ways to engage young people in policymaking. And I think it's firstly by actively inviting them into the conversation, and secondly through allowing them to take genuine, impactful roles. So I say the first one of like actively inviting young people in, because I think that young people are too often made to feel that policy and activism isn't really for them because we're not really experts and we're not very particularly like represented in politics. And in instance, I think that this has been done very well with Bite Back and with the work that I've done is when I attended a meeting with the Greater London Authority on preventing diet-related ill health among children, and I was speaking on my experiences facing a flood of junk food marketing advertisements. And after speaking on my experiences, the chair of that meeting, he kept inviting us back in every time that there was new input or a new topic. He would bring it back to the young people and ask us, okay, well, what do you think of this? So we were actively given that space to talk about what we felt and empowered to join in with that conversation. And we were like a valued and integral part of that conversation. And then on the second part, I think when adults physically step back to allow space for young people to enter, it can have a massive impact because you're no longer simply like a tokenistic add-on, but you're an individual with a great capacity to contribute to the debate in your own right. And I really felt this when doing an MP drop-in event on the food system, because the adult leads and the youth coordinators physically stepped back in the room and gave us that space to receive and discuss with MPs. Thanks, Maria.
Thanks so much, Alice, for those really powerful examples and insights. I turn it back over to Toyib.
Thank you for your intervention, Alice and Maria. Indeed, we need to protect young people. Over 90% of the people on this call, for example, agree with us talking about the awareness of the topic. Next slide, please. Now we go to Danielle. Given your experience in the Caribbean region, what are the roles of community partners, including young people themselves, in developing, implementing, and monitoring policies that prevent harmful commercial marketing?
Thank you for the question, Toyib, and really for allowing the Healthy Caribbean Coalition to be engaged in this crucial conversation. So I want to start by painting a picture. So imagine a classroom adorned with fast food branded chalkboards and school supplies, a school sports day where banners of ultra-processed products fly high, and enticing alcohol ads featuring young people, especially young women, are on social media. This is our reality in the Caribbean, and I know these red flags are not unique to our region and that they're global. So what can we do? I think we must not underestimate the power of policymakers. They must implement robust policies to tackle the harmful activities of these industries, prioritizing people over profit. And as advocates, we find our footing when policies and engagement guidelines with industry are in place. The truth is, though, policymakers are still working on this, hence the critical need for this report. Given that no country in the Caribbean has implemented policy to address marketing of unhealthy food to children, except in Barbados, where this is limited to the school environment, all activities that bring this issue to the fore are paramount. Based on our experience, there's role for community and young people by one, initiating conversations. Many young people, or many people in general, don't understand the harm in big food, big tobacco, big alcohol's marketing efforts. They don't see the billions of dollars poured into strategic marketing campaigns to shift consumption patterns and foster lifelong customers. This is especially true in resource-constrained settings like islands in the Caribbean, where these companies step in when other companies simply cannot. So at the Healthy Caribbean Coalition, we conduct capacity building sessions on harmful marketing for our civil society organization partners and youth advocates. And this ongoing exchange of information with advocates is important for us for many reasons, including the fact that our small community settings warrant a unique approach with industry, given that some companies, for example, sell healthy and unhealthy products. We also reiterate that marketing of unhealthy commodities is a public health issue and a matter of human rights. The Caribbean grapples with some of the highest rates of NCDs and obesity in the world, and so stagnation on this issue is really not an option. Number two, building evidence and resources to support policies. So in my role as advocacy officer, I collect instances of harmful marketing and encourage our youth and civil society organizations to do the same. These examples shape discussions with policymakers and inform advocacy efforts. Healthy Caribbean youth members have developed model policy and legislative guidance to regulate the availability and marketing of unhealthy beverages and food products in schools, and even an advocacy agenda to address childhood obesity using a rights-based approach. They're also leading research on healthy food environments. And finally, number three, advocating for change. Our youth members have penned impactful letters to the editor and released Instagram videos drawing attention to these harmful marketing practices within school environments and rallying for policy action. Recently, we joined forces with other youth organizations, composing a letter to the governing body, convening all heads of government across the Caribbean region. In it, we outline the need to regulate the sale and marketing of unhealthy foods in schools and engage youth meaningfully in the process. Partnerships, especially with stakeholders from different issues like climate change, are paramount as they serve as a megaphone for our messages and can also be a shield of protection. Finally, we push youth advocates to have a voice in influential spaces. They've contributed to discussions at the recent SIDS high-level meeting convened by the WHO and supported local policy design in Barbados. So in closing, Toyib, no effort is too small. Together, they create spaces for dialogue and mobilize communities. In all that we do, we must let our voices resound, urging policymakers to rise and prioritize people over profit. Thanks, Toyib.
Thank you, Danielle. Indeed, no effort is too small. And I really like your point about the meaningful engagement of young people. In the policy report, we make a case for this, and it's one of the recommendations. Now we go to Anna. Young people, including adolescents, are active in the digital environments and across social media. From your own perspective, what can be done to ensure young people are safe from harmful marketing when online?
Thanks for the question, Toyib, and I'm going to jump to Spanish to tackle this. Lo que
What I've recommended, and from what I've heard here, I think there are many points in common, but I think something very important is first to acknowledge that self-regulatory measures that are implemented in most of our regions in our countries have shown to be absolutely ineffective. They do not protect the youth appropriately. So we need, society needs, and people who work for child health, we need to get closer to policymakers, to agencies and governments. And we have a lot of evidence on that. Maria said a few minutes ago, even though we have these evidences, industries are guided by their own interests. So we should not let the industries have this power. And I think we have many tools and wonderful recommendations, such as the ones that have been presented here, that help us get closer to policymakers and decision makers to help children and youth online. So I think this is something decision makers should have clarity on this, that self-regulatory measures are ineffective. And I think it's very important to consider an approach of children's rights. We know this is a public health matter, but it is also a matter of rights. And we have the higher interest of children. So this makes our governments have the obligation to prioritize the protection of health in the life of children. So this allows us to make use of this powerful tool that has been supported by international organizations. And finally, something that has also been said is involving youth, young people to in this discussion and bringing them to the decision making, because the industry is doing that. The industry is doing that in a way that we have influencers. And something that's really odd, as I was preparing for this session, I was reading news that said in Latin America, being a YouTuber or being an influencer was the thing that kids most say what they want to be when they grow up. Most kids in Central America, Mexico, and South America said, I want to be a YouTuber or an influencer. So that means that kids aren't seeing a space where they can fit in, where they can have a future. And this is a place that's absolutely dominated by companies' interests. So governments and society have to include children, because industries are including children for their own economical benefit. So I think this is the most important thing, to include these youth so that they can defend their own rights. Thank you for your question.
Thank you, Anna. Good intervention there. You made an important point about focusing on comprehensive policies and not self-regulation. You also reinforced the need to regulate, influence, and market. All of this are also like some of the points raised in the policy report. Moving to Gabriel, given your experience with the bigger picture project and work with young people, what roles do you think young people can play in shaping their environment and health policy?
Yes, thank you so much for having me, Toyib. Before we begin, I want to take a moment to acknowledge the injustices happening in Palestine today. A big part of my work is the challenge of systemic violence happening against young people and how that violence is often rooted in colonization. So it's important to observe the ways access to fresh food and water and safe environments are currently being used as weapons against a population where at least half of the age of youth that we would work with. So with that, what's the bigger picture project? It's a collaboration between Youth Speaks and the University of California, San Francisco's Center for Vulnerable Populations. It was created about 10 years ago in response to the disproportionately high rates of type 2 diabetes in youth. It's a fact that about 1 in 3 youth in the United States are expected to get type 2 diabetes in their lifetimes. This number increases to half for Black, Indigenous, Latinx, Pacific Islander youth. And why is it like this? The same reason that COVID-19, poverty, asthma rates, and more disproportionately affect these same communities. One of my favorite poets and sociologists, Eve Ewing, says that when you place an equal opportunity virus on an unequal landscape, the results are often unequal. But it doesn't have to be this way. These conditions were created by people, which means that they can be changed by people. Our strategy is to share the important facts I just named in ways that resonate with the lives and experiences of the youth we hope to engage through poetry, hip hop, online videos, by coming directly to their schools with assembly presentations and kickballs for recess. We meet youth where they're at, and we ask, why are the water fountains not working at your school? How many liquor stores are in your neighborhood versus how many grocery stores? And what is in your refrigerator and how did it get there? We introduced the idea of type 2 diabetes as an environmental issue, one that isn't natural, but is artificially created as the poisonous beverages that are constantly being marketed to us. Then we get out of the way, inviting the youth themselves to tell the stories of what they notice about their surroundings. In a world created by and dominated by the voices of grown people, we know that there's power in inviting young people to speak up and speak back to power, sharing their personal experiences with type 2 diabetes. We know that it resonates on a deeper level with young people to hear other young people that share these experiences. And we know that one of the most powerful ways to activate young people as a base is to help them understand that they're being targeted, that they're being treated wrongly by unjust systems, and that they have the power to do something about it. Some of the results from our work we know is that the bigger picture helped pass the United States' first ever citywide soda tax in Berkeley, California, which quickly spread to San Francisco and Oakland. And this helps fund actually like community gardens and education programs directly within their schools. Our works also helped inspire countless young people to challenge the unhealthy food and beverage offerings at their schools. And young people started conversations with their families, talking to them about what they've learned and bringing that knowledge back home. And with my continued work, this next school year, I'm going to be working with the Ecology Center's as their first poet in residence to lead a paid writing workshop for Bay Area poets this fall. The topic's climate justice, food sovereignty, and histories of resistance and how these all relate to each other. The poems we create together are going to be toured throughout the city in spring 2024. And my goal is to evolve this model past the quote unquote scare to care model of education that it was often necessary in the last 10 years to one that's more deeply rooted in histories of resistance specific to our location in California, thinking about the Black Panthers, the indigenous lineages we come from, and helping to understand how that we can be in right relationship with our food environment and our environments. We know that in a moment where youth are constantly barraged with narratives of urgency, this idea that if we don't do something now, it's the end of the world, there can be a sense of apathy and hopelessness that can develop. We also know that one of the strongest ways to combat that is by offering solutions and incorporating the lessons of climate justice and food sovereignty into every part of their education. And finally, we know that identity is of the utmost importance when doing this work. We know that sugar-sweetened beverage companies and capitalism in general have co-opted identity to sell its products. Just last night, I saw an ad by Vitamin Water on the popular video game Fortnite. And we know that they want to separate us from our relationship to the natural food where we come from and replace them with natural flavors. They want to separate us from our identities and the rich, vibrant histories that we come from and reduce us to target audiences categorized by age, gender, income so that they can sell us products. But what happens when we unlearn these toxic lessons and reorient ourselves and our identities and our possibilities in a mutual relationship with the land, in long and effective histories of life and sustainability and resistance to the very things that threaten to maim us? That's what we hope to explore this next year. I'm going to pass it back to you, Toyib. Thank you.
Thank you, Gabriel. Thank you for sharing about your work, and thanks to all panelists. We've had rich interventions, and it's now time to hear from the audience. Please take time to share your questions with us via the platform. Next slide, please. We already have a question, and the question is about why are we focusing on youth in schools? And how about young people who are at home and who do not have jobs? And I think this is quite relevant in thinking about youth-friendly spaces and not just the environment around schools and thinking beyond schools. Just checking if any panelists want to have a go at this. Should we start with Maria? So from the policy reports itself, because I know we looked at different environments. Do you want to speak to the question?
Yeah, definitely. So first, I think we gave extra emphasis on schools because there's such a high concentration of children at schools. It's definitely a child-dominated environment, and it's an area that is more feasible to regulate. It's hard to regulate public transportation, sports stadiums, because there's adults. It's considered a public space. And so there's just different laws, different barriers and challenges to getting around that. But in a school, children are the priority, and policymakers in a UNICEF survey that came out earlier this year, policymakers cited schools as one of the environments that they thought would be most feasible to employ regulation in. And so that's why we gave special attention to that. And then on the other, I think the second part of that question was talking about children and young people and why just to focus on children and young people. We decided to take a bit of a broader stance. So the policy report goes from young children all the way up to young people age 30. And even though young people age 18 to 30 typically aren't considered children and aren't given the same protections as children in regulation, we know that habit formation in childhood and even as a young adult leads to your health outcomes in your entire life. And we wanted to take a life course approach. And so you're still forming habits as a young child and as a young adult. And so if we can reduce the harmful marketing that children and young people are exposed to, this is going to have really positive outcomes for them much later in life and prevent NCDs, or at least minimize the effects of NCDs.
Thank you, Maria. Just checking if any other speaker wants to speak to other environments outside school.
I would like to briefly add something to that. And I would like to bring on the experience of Peru when regulating the sales of ultra-processed products in schools and also the advertising of these products. And I think they made a wonderful justification for it by adding that schools are learning environments. And when you're a child and you're at school, you don't just learn from what you see here in a classroom from your teachers and from your peers. You also learn from what you see around, from your surroundings. And if your school surroundings are filled with advertising and with ultra-processed products that are unhealthy, that also becomes part of your learning experience. So I think the Peruvian example is a great one to incorporate how education spaces have to be aligned with what's best for the children. So yeah, I completely agree, and I think we can learn a lot from different countries that have regulated school environments.
Thank you. Just moving on to another question that we have. This says, are there examples of strategies that young people, especially in low and middle income countries with limited resources and lacking direct access to policymakers, can employ to combat the harm caused by harmful marketing targeted at children and teenagers? So possible roles for young people in low resource areas to engage in this work, even though they don't have direct access to policymakers. Danielle, do you want to have a go? And then maybe Gabriel.
Thanks, Toyben. I think it's a great question. So from our end, and I guess going back to something I would have mentioned in the intervention, is raising voices. And there's a lot of value in partnerships as well in terms of amplifying messages. So we've had really great success in partnering with youth organizations in perhaps writing a call to action, letters to the editor, however we can get our concerns out there, I think, is really valuable, especially in the instance where you might not have direct access to policymakers. So raising your voice, and I think a big tactic or an important tactic in that is not undermining the value of partnerships in doing that.
Thank you.
Absolutely. Yeah, I can hop in after that as well. I'm thinking of a couple Oakland cultural organizers out here, Jeff Chang and Fabiana Rodriguez, who often quote, they say culture shift precedes policy shift. So the work of shifting culture comes first, and then the policy shift. And I also want to big up that young people are the greatest creators of culture that have ever existed. And we can look at some of our current and past movements for evidence, thinking about the globally unifying and life-affirming force that is hip-hop, to the civil rights movement that's evolved into the abolition movement in recent years, challenging the prison industrial complex, the Sunrise Movement, the way it activates young people to challenge their governments to move with that same urgency that they feel. And these are all movements led by young people, often young people in conditions where folks are saying that, that they don't have power. And specifically out here in California, if we looked in 1969, the Black Panthers of young people started the free breakfast programs that eventually spread across the whole United States. So yeah, when thinking about hip hop, when thinking about the most marginalized, it's most important that these young people are speaking up, speaking their truths and speaking to each other because of the incredible movement work that can come out of just that people power. So big advocate for that, and very excited for the ways globally connected young folks can move in a way that they couldn't, especially in this moment right now.
Thank you, Gabriel. We have a couple more questions. There's a question about if the data collected by the private sector for marketing can be obtained by the public health sector. And I think maybe this is a question that Maria might be able to speak to from the policy report, if we saw any instance where the public health sector was able to obtain data from the private sector.
Yeah, I think this introduces a bigger topic about children and young people's rights, which I know our presentation, we only have a short amount of time, we were focusing on health, but the policy report does go into the rights that children have guaranteed to them. And so just looking at the UN Convention on the Rights of the Child, which is the most widely ratified convention in the world, children are guaranteed the right to privacy, and that includes data privacy, data protection online, safety online and in digital environments. And so we do have companies violating this right by collecting children's data and using it for marketing purposes. And I think we should be cautious about trying to counteract that by continuing to spread children's data. I think the solution is to stop private companies from collecting this data. So I would just be cautious about encouraging more people to have this data and use it. But I understand the argument for wanting this data to try and counteract it in the public health sphere.
Thank you, Mary. I think totally agree with you. I think prevention is probably the best option here, ensuring that the private sector is not just collecting data of young people. There's another question here which I think might go to Alice. It's about the use of body enhancement. The question is, I have noticed harmful marketing from a few body enhancement businesses in my country. Popular celebrities are also helping to promote these businesses with false health information. How can I counter this trend without offending business owners and triggering the people, the spirits, and sensitive about their body image? So it's a question about how someone can engage in advocacy around body enhancement while being sensitive to the needs of people who might be looking to use these products.
I think just introducing more voices into the conversation, having this respectful conversation and opening it up into a debate, because I think a lot of the time there's just one very powerful narrative coming from, say, the big companies pushing it, or the local businesses who are benefiting from the funds that the big companies are giving them. So I think opening the conversation up for more people and challenging the narrative of kind of individual blame and needing to fit in with a certain kind of like way of looking. So I can't speak too much on body image because I campaign on junk food marketing, but I think there's similarities in terms of challenging the narrative, because there's a massive idea of kind of individual focus and you need to change your dietary habits instead of we need to question why there's a system set up for us to eat unhealthy food as the status quo. So yeah, I think just kind of beginning a conversation and exploring other options. So how are other ways that we can make ourselves feel better about the way that we are, instead of just accepting this kind of answer that is put on us by big corporations with vested interests.
Yeah, and if I could add to that, I think in this space we typically talk about the traditional harmful commodities, tobacco, alcohol, junk food, gambling. But when we conducted the focus group discussions with children and young people aged 13 to 30, every single person in both focus group discussions brought up beauty products, skin whitening products, dietary supplements, all these things that we don't typically put in the bucket of contributing to non-communicable diseases and harming our health. But I think this is giving us good direction that we need to think more about mental health. And we need to think beyond the traditional unhealthy commodity industries. This is what children are telling us are harming them. They see it on social media, they see it online, that they need to buy skin whitening products or dietary supplements to grow muscles, to become thin. And this is what's concerning them, they told us. And so I do think this is giving researchers, policymakers, activists good direction and saying we need to broaden our conversations to talk about these products as well.
Thank you, Alice and Maria. Just waiting to see if we have more questions. Okay, it's looking like that's it for now. Moving to the next slide. Before we end today, we have some poll questions for you to understand a bit more your awareness of the topic and what you'll be taking from this session. Can you please put the post-session poll up? As you respond to these questions, we would like to know what you would be doing following this session. The policy report in itself, which we could not have gone through throughout today, would be available, is already available on NCD Alliance's website. It's available for you to download, to already share with your friends and colleagues. We are hoping that national governments, policymakers take up the recommendations and the call to action. But in addition to that, we'd also like to hear from you what your awareness are about the topic and what you would be doing following today's session. Thank you. Let's give it some time for the poll questions, as there are a few this time. We have also shared the policy report in the chat, and we have the QR code. So if you want to download, please feel free. Okay, thank you. We would be closing the poll now. And from the initial responses, it sounds like almost everyone that has attended this session is aware of the topic, and a lot of people are saying they would be doing something, with a significant number, above 70, saying that they'll be sharing the reports, the policy reports with people, which is really, really good. A couple of people have also mentioned that they would be having a conversation with a friend. Yes, that's one of the things that we can do. Alice already mentioned how we should be bringing more voices to the topic. Next slide, please. So as we wrap up today, in closing, the rights of young people must be protected. We deserve and long for a world where we can reach our full potential, safe from the harm of unhealthy products. We deserve to be protected from harmful commercial practices. We call on national governments to prioritize health and safeguard our future by enacting and strengthening health policies and legislations. In doing this, it is important that they consider enablers and barriers, as listed in the policy report. They also should meaningfully engage young people and communities. These are some of the points that we've heard from our panelists today. We have shared the report with you in the chat. We hope you download it and share with your governments and among your networks. As Alice has mentioned, let's bring more voices to the table. That's all from today. I thank you and enjoy the rest of the forum.